It is my pleasure to serve you during these challenging times. From doing online consultation for the past 3 months, I've seen mild to severe cases that needs hospitalization. I am Dr. Lavinda, board certified dermatologist. Today, I will be talking about the top 3 reasons for derma consultation during the quarantine period and some practical tips to help educate my patients. First is contact dermatitis. Contact dermatitis is the appearance of a red rash caused by a direct contact with a substance or an offending agent, the most common of which is irritant contact dermatitis. This usually occurs when a strong irritant comes in contact with the skin after a single exposure, or a repeated exposure can also result from this, especially after a contact with a mild irritating substance. Nowadays, the use of rubbing alcohol, bleaching agents, and detergents are some of the culprits I saw. So practical tips. Avoidance of the irritant or the substance that causes the contact dermatitis is our main goal. So instead of using alcohol for sanitizing hands, why not do hand washing frequently instead using water and mild soap? Reserve using alcohol when there is no access to water. Use also protective gloves when handling bleaching agents or chemicals is a must. In cases when you've used an irritating substance with a bare hand, wash hand immediately with mild soap and put on a moisturizing lotion to restore the outermost layer of the skin and keep hands hydrated. Second is acne. I've been receiving a lot of acne consultation lately. I can't completely discuss everything about acne here in my video. I'll just point out the most important ones. Acne vulgaris or pimples in layman is a skin condition involving the oil gland. It occurs when the hair follicle or what we know as pores are plugged with oil and dead skin cells. So there is clogging of the pores. So what are the reasons why we develop acne? And why is that so that others have mild acne while some have moderate to severe ones? There are a lot of factors for developing acne. So most research shows that there isn't a specific gene that one can inherit. However, while there isn't a gene mutation directly linked to acne, some families may have a tendency to overproduce sebum and dead skin cells, and that leads to clogging of the pores. In addition to that, some form of acne are hormonal. So one is genetically predisposed to excess androgen production. Other risk factors would include stress, hot, humid weather, and diet. Diet and acne have always been a controversial topic since then. Research shows that high glycemic diet or high caloric diet are culprits of acne. Certain foods raise your blood sugar more quickly than others. So when your blood sugar rises quickly, it causes our body to release a hormone called insulin. And having excess insulin in our blood can signal our oil glands to produce more oil, and that could lead to acne breakout. So these foods that are high in glycemic would include sweets, pasta, processed foods, white bread, and many others. So consuming a low glycemic food made of complex carbohydrates may reduce acne. So like choosing whole grain, unprocessed foods, and adding antioxidants to our diet may help reduce the inflammation. So what are those antioxidants that you can add to your diet? So this includes the zinc, vitamin C, vitamin E, and vitamin A are good antioxidants. So my practical tips for acne. There is no magic formula for acne treatment. Every person is unique, so treatment should be individualized depending on the severity of acne. So is my patient having a mild or a moderate to severe acne? When we want to get to the bottom of acne, we aim to regulate the sebum production, the hormonal imbalance, and the bacterial proliferation. What works for others may not work for you. Commercialized anti-acne products like soaps, toners, or creams may not be enough. Some patients may need oral medications for acne like isotretinoin or oral antibiotics. This may need prescription from your dermatologist. Don't experiment on anti-acne medications on your own. There are a lot of online creams that have high potent steroids and high concentration of mercury, which are very hazardous to our health and our skin. These medications can lead to irreversible skin damage like atrophy, telangiectasia, and scars. I'll be talking another type of acne, which is maskne or masked acne, or we call that acne mechanica in dermatology. It's actually caused by wearing masks. The mask traps the oil and the sweat coming from our pores. Due to friction, our skin becomes irritated, leading to tiny papules or tiny pimples. The treatment for masked acne is similar to the common acne vulgaris. Topical medications or oral anti-acne medications may be necessary in certain patients. But since you are required to wear masks at all times, what you can do is that you can put a cotton in between your skin and the cloth of the mask to help absorb the sweat and the oil coming from your skin. And also try to change masks frequently, especially if your mask is already soiled. So how can you prevent acne? Avoid food that are sugary and high in carbohydrates. Get enough rest and sleep. Choose products that are non-comedogenic. That means these are the products that would clog your pores. Wash your face twice a day. It's not advisable to excessively or frequently wash our face. It may cause our skin to produce more oil. Stick to a regimen and a treatment plan. So it's very important to seek a consultation to a dermatologist. Anti-acne medications have also side effects like redness, stinging, peeling. It may take several weeks to months before we can control your acne. If you have been applying your medications for several months and years, and if you feel that your anti-acne medications are no longer working, consult back to your dermatologist because you may need to upgrade or change your medications or add certain clinic procedure to help further with the control of your acne. The third reason for derma consultation is eczema. There's a lot of types of eczema, but I'm going to talk here dyshidrotic eczema. When we say dyshidrotic eczema, it is the appearance of tiny blisters on the fingertips and also on our feet or toes. These blisters can get infected, so there can be pain, swelling, and crusting. What causes dyshidrotic eczema? It can include stress, frequent wetting or washing of the hands and feet, certain food, especially in patients with nickel or metal allergy. So how do we prevent dyshidrotic eczema? One is by moisturizing our hands after washing. Get adequate rest and sleep. Boost your immune system by eating healthy and taking multivitamin. Avoid trigger allergens, especially if you have allergy to nickel or metal. There are certain foods that are high in nickel content, like oatmeal, soya beans, coffee, tea, tomatoes, nuts. So those are the top 3 derma reasons. Hope you learned from my video. Thank you for watching. Bye!